good morning. My name is John Michael and I'll be your nurse for today. I'll be working here from 7 o'clock in the morning until 7:30 in the evening. That's my shift schedule. And you are under Dr. Papsidero, your provider. And I'm here to do some full set of head-to-toe assessment and your full set of vital signs, which includes your temperature, your pulse, your respiratory rate, your blood pressure, and your oxygen saturation. And of course, that also includes your blood sugar and your neurological exam as part of your head-to-toe assessment. Before anything else, can I just step back and do my hand washing? Is that okay? Thank you. All right. First things first, I'd like you to verbalize your full name and date of birth as I check it against your wristband. Is that okay if I check your wristband, ma'am? Perfect. Can you state your full name and date of birth for me, please? Perfect. All right. So I can confirm that I've got the right information against your wristband as you verbalize it. Perfect. And how would you like me to address you, ma'am? Perfect. Okay, so first things first, thank you for your participation. And just a quick sort of instruction, this is your room, your single unit room. You are admitted at the Med-Surg telemetry floor in the second floor of the hospital. And again, I am your nurse, I am John, and you are under Dr. Papsidero, your provider. And just a quick sort of safety briefing. So here, this is your call light. In here, we have the red button that says nurse call. So if you have pain or if you have unusual symptoms of if you need me to help you to go to the bathroom or anything, please let me know by pressing this call light red button here. And we will be coming to help and assist you, okay? And so on, you've got the buckles here for your TV and your light and of course, everything in between. And also, you've got your bedside phone there wherein you can contact outside, especially your relatives or family if you need to. Just dial 911 first and then the long number after that. And of course, if you need to speak to me or to any of the staff, you can always do that and dial 225, okay? So right now, are you comfortable with your position? Do you want me to help you with the toilet? Do you feel like you're going to the toilet? Okay. Should you need anything, you have the call light button there, and I'll be going ahead. I'm gonna do another set of hand washing for safety, and I'm gonna gather the equipment for the assessment. Okay? Thank you very much. Hello again. It's John here again, your nurse. So I'm back with my equipment, and I've done my hand washing. So let me do my donning of gloves, and we'll go ahead with your head-to-toe assessment and your vital signs, including your neurological assessment. Is that okay? All right, thank you. All right, ma'am. So, are you comfortable at the moment? Do you need anything for now? Breakfast? Okay. Breakfast will be served shortly in half an hour from now. It's still 7 o'clock. And you'll be fine, okay? This assessment will only take us 20 minutes. Is that okay? Perfect. Let me go ahead and check your head down to your foot, and we'll do your vitals, okay? So let me start by checking your head. Would that be okay if I touch your head? All right, thank you. I can see that you've got good dark hair here going on, and there's no signs of infection, no inflammation, no dandruff, so that's fine. No discoloration either. And also with your face, there's no discoloration. However, there is pallor that I can notice here in the color of your skin. And let me go ahead and check the pupillary response of your eyes. So with this, I'm gonna use my pen light. I'm gonna shine the light. What I need you to do is to look straight ahead as I shine the light, okay? All right. Straight ahead for me. Alright, so both of your pupils are equally round, reactive to light and accommodating, which means they are all good and normal. Alright, let me check your nostrils, and I can see that you have nasal cannula here, let me check the rate of your oxygen. This is 2 liters per minute as prescribed by Dr. Pachidero, which I've checked earlier, which is good. I'm gonna go ahead and remove your nasal cannula for now, and I'll observe your nose at the same time your ears, okay? All right. I'm gonna shine a light too to check the nostrils inside. Okay? I can see that there's no obstruction, there's no signs of unnecessary drainage, and you've got good and the same shape and size of your nose. Perfect. And also with your ears here, there's no signs of drainage, there's no signs of inflammation, and at the back and the top of your ears, there's no pressure damage coming from the oxygen nasal cannula. Okay. Also with the other ear, perfect. No pressure damage behind the ear at the same time. There's no unnecessary inflammation or signs of infection in the other ear. Perfect. Can you open your mouth for me and tongue out? Okay. All right. There's no signs of infection and inflammation in your mouth. However, your tongue appeared to be pale, and also the rest of your mucous membranes there inside of your mouth. The uvula is also intact. Are you able to speak full sentence for me? State your full name. Perfect. Okay. So that means that your airway is intact. All right. And also, I can also go ahead and check your chest sounds, front and back, and I'm gonna use my stethoscope. Once I put my stethoscope in your chest, front and back, I want you to do your breathing, deep breathing, okay? All right. I'm gonna start with your chest. I'm gonna expose this one at the same time too, okay? All right. Alright, so just right there, I want you to have your dignity and privacy for now, okay? And I don't want you to have cold too. Alright. Okay. Okay. Alright, I'm gonna listen to your heart sounds right now. Okay. Alright. Alright. So the lung sounds and your chest sounds are all noted, and can I just go ahead and check the asymmetry of your breast? Okay, there's no signs of inflammation or infection. They are in the same shape and size, which is good. Okay, let me go ahead, ma'am, and check the lung sounds at the back of your chest. Okay, so we're just gonna ask you to lean forward. Okay. Let me help you with that. Is that comfortable for you? Are you okay? All right. All right. So I've checked the lung sounds at your back, and there's no signs of pressure damage or redness going on here at the back of your chest and also at your bottom, which is fine. Okay, so what I've heard in your lung sounds is that there is an inspiratory and expiratory wheezes and crackles, which means that you might have some infection going on and fluid retention in your lungs. Okay, I'm gonna inform Dr. Papsidero, your provider, with that. Okay, but right now let me go ahead and check your abdomen down to your legs. Okay, so with that I'm gonna expose your the rest of the part of your body, okay? But before that, let me check your arm too. Okay, your armpit is fine. Your skin, though, is really cold to touch, okay? And I'm gonna check your skin turgor. You've got poor skin turgor, which means that your skin comes back quite slowly. And I can notice that you've got an IV access here, gauge 22, at your right forearm, okay? And then I'm gonna check also your capillary refill here in your right tongue. Okay, so your capillary refill is 4 to 5 seconds, which means that is poor. Okay, so that means that there is a circulatory problem. All right, and then let me go ahead and check your other arm, starting from your armpit. Okay, the armpit is fine. Although, again, this arm is cold to touch, and the skin turgor has got delay, which means that it is poor skin turgor. And I'm gonna check also your capillary refill here in your left thumb. Your capillary refill is 4 to 5 seconds, which is very poor, and it's so cold to touch here. So right now, let me maintain this blanket here to prevent you from having cold, okay? Cold temperature. And let's confirm that one as we take your vital signs, okay? Let me go ahead and check your abdomen. With this abdomen assessment, I will auscultate, listen to your bowel sounds, and do the palpation and percussion afterwards, okay? And let me know at some point if you feel pain or tenderness when I do the palpation, okay? All right. Okay. For abdominal quadrants has got positive bowel sounds, which is good. I'm gonna do my palpation right now. And again, let me know if there's any pain as I press and release my hands, okay? Okay, is there any pain? All right. Okay, so I can notice that your abdomen is quite distended. So let me go ahead and grab an tape measure and measure the abdominal girth, okay? Real quick. All right, so I've noticed that you've got elevated measurement of your abdomen, so I'm going to record that one and let the provider know. So that basically means that you might be having fluid retention in your abdominal cavity, okay? All right, so while we go here, before we go that, let me check your arm strength too. Can you raise your arm for me? All right. Can you squeeze my hand? Perfect. So I can notice that you've got mild weakness in your right arm. Okay. And then same goes with your other arm. Your left arm. Raise that one for me. Okay. And can you squeeze my hand? Okay. The same thing. You've got mild weakness in your left arm. Okay. All right. Let me go ahead and do your other parts of your body. Okay. Right now, we're going to check your genital area or your private area. Is that okay for me to proceed? Perfect. All right. So with this, I'm going to check if there's any signs of inflammation or infection. Okay. All right. I can see that your labial folds are all equal in the same symmetry. There's no signs of inflammation or infection. There's no unnecessary drainage. And your pubic hair are all finely distributed, which is fine. Okay. There's no also skin issues in your groin area, so which is fine. All right. Let me go ahead and check your legs. Okay. All right. Okay. Starting on here in your right leg. Sorry. So, okay. So I'm gonna feel the pulse too. Okay. In your leg. Starting here at your femoral, at your popliteal, posterior tibial, and your dorsalis pedis. Okay, okay. So all the pulses on that side are all weak and bounding, strong, weak and bounding. Okay. So I can also touch here and feel that you are having cool to touch skin with pallor color, and also at the same time we'll check your skin turgor. The skin turgor is really poor. It comes back slowly. And I can also see that you've got edema here in your lower right leg. I'm just gonna check and palpate it. Okay, so I can see that that is peaking edema with a grade of +3. Okay, and I'm gonna check also your capillary refill here. Again, your capillary refill is more than 4 to 5 seconds. Which is, that means that you've got circulatory problems with your extremities, and it's so cold to touch. There's no signs of pressure damage here, so which is I'm gonna go ahead and check your other leg too. Are still okay? Alright. Right, starting with the pulse here in your femoral, at your popliteal, at your posterior tibial, and your dorsalis pedis. Okay, so the pulses on this side too is weak and bounding. Can I also check the capillary refill here? It is also 4 to 5 seconds, which is poor capillary refill. It is also cold to touch. The skin turgor is also poor. The skin comes back slowly. And you also got an edema. I'm gonna touch that one here to grade the edema. Okay, this is a beating edema with +3 to 4 grade. Okay, so there's no also signs of redness, inflammation, or pressure damage in your leg. Okay, it's just maintain here to prevent it from having cold. Okay, all right. While I'm here, let me check also the pulses in this arm, starting at your brachial pulse. Okay, and your radial pulse. Again, the pulses here are all weak and bounding. Can I also check your carotid pulse here? Okay, you've got a strong pulse here going on in your left carotid. Okay, let me check the other arm too. Starting at the carotid. Strong bounding pulse in your brachial. Okay, and also in your radial. You've got weak bounding pulse here. Okay, so with your IV access, there's no signs of phlebitis or infection, and it's dated since today, which is fine. And I also can notice here that you've got a urine catheter inserted today. So basically, the purpose for that, in case nobody had explained to you, is to monitor your urine output. Okay, and I can see here in your bag that it is the output is color yellow, light yellow. Okay, so we just want to make sure that every single time we are going to drain this and measure this. Okay, all right. Right now, let me check your vital signs: your temperature, pulse, respiratory, blood pressure, your blood sugar, and also your oxygen saturation and your pain score. Okay. Let me check your blood pressure. While you have your IV access there, I'm gonna check it in your left arm. Is that okay? Is this the arm that they used earlier during your blood pressure measurement? Definitely yes. Okay. Did you have surgery in this arm or in this chest here? No. Okay. Perfect. So I'm using the adult cuff. I'm going to insert this 2 to 3 centimeters above the antecubital fossa, making sure also that there is a distance of the arm to the cuff, 2 to 3 finger breadth, 2 to 3 fingers. I mean 1 to 2 fingers. Okay. Are you okay there, man? Check your blood pressure. Your blood pressure is 80/50. Okay. Right. So let me check your pulse, and I'm gonna put your arm across your chest. Okay. We'll just need to do it in your other arm. Okay. Do this in 1 full minute. Okay. Thank you, ma'am. So your pulse is a little bit elevated, above 100, which is 110 to 120 beats per minute. And your respiratory rate is 25 to 28 breaths per minute, which means that it is also elevated. And then I can also see that there is an equal expansion, rise and fall of your chest. However, there is signs of uses of your accessory muscles. Is that normal for you? Are you struggling to breathe right now? No? Okay. All right, so is that because of your COPD? Okay, all right, okay. So we just want to maintain this position, upright position, to maintain the expansion of your lungs and for your ease breathing, okay? And then I can also see that you've got incentive spirometry there in your bedside table. You can also use that one at some point when you're comfortable. And we are going to teach you the peak flow as well, as since you are using your inhaler and nebulizer. And then you also have your water there at your bedside, which is just to remind you that you've got 1.5 fluid restriction, and we need to measure your intake and output with that. And also you've got a cartridge of medicine here. Is this for you? Yes. Can I just check this? Okay, so this is your Apixaban dated. Oh, this is already expired, ma'am. This is expired last year. Okay, so can I just go ahead and discard this? Okay. The reason for this is to prevent you from having any reactions or any errors on the part of the nurses, okay? Thank you. All right, so let me also check the rest of your vitals, okay, including your temperature and your oxygen saturation, okay? Just gonna pop your oxygen saturation oximetry here. Okay, just gonna check your oral temperature too. All right, perfect. Your temperature is quite low. It's 36, okay? And your oxygen saturation is 88%. And you've got 2 liters per minute. And the target saturation, as per Dr. Papsidero, in relation to your COPD and congestive heart failure, is 88 to 92%, which is good. We just want to maintain that saturation level. If by any chance, if your oxygen saturation goes down to below 88, then that's when we're going to titrate your oxygen out, okay? And we're gonna keep an eye on your oxygen saturation, okay? Also checking your blood sugar. I heard that my colleague have checked your blood sugar earlier, and it's within the range. This is 110, which is good, okay? So right now, I know it's a silly question to ask. Do you know where you are at the moment? Geneva General, okay. Do you know what date and time is it right now? Perfect, okay. So your Glasgow Coma scale, or that's part of your neurological assessment, is 15 out of 50, which is perfect. There's no signs of neurological deficits. There's no asymmetry in your face, in your arms, and also in your legs. There's no garbling or a face chest sign in your speech, so that's fine. So your airway is not compromised. Your breathing has got increased respiratory rate. Your circulation, you've got the IV access going on, and we're gonna hope the fluids as prescribed by Dr. Papsidero, bearing in mind that you've got fluid restriction, and also your blood pressure is 80/50, which I will note that. Your pulse is very tachycardic at 110 beats per minute. And also, your skin is cold to touch, capillary, and also your skin trigger are all poor. You've got for the disability, you've got your blood sugar is 110, your GCS is 15 out of 50, which is fine. And your exposure for your skin is, as I said, cold to touch, and color is pallor. There's no signs of bleeding going on here. External bleeding, I mean, going on in your in the rest of the parts of the body. There's no pressure damage also, but there's also a notable pitting edema on both legs with grade of 3 plus 3 or plus 4. Okay, there's equal strength in your extremities, both upper and lower, which is fine. Okay, all right, ma'am. When was the last time you had your bowel movement? Okay, this morning. Is it form or loose? Form, okay. Is that your regular? Perfect. Okay. All right. So You've got everything here for you. You've got the call light here in case you need it. Press this red button again if you need me. I'll come and help you, okay? And again, we just want to make sure that everything is here within your reach. You've got your bedside table here with your water. And should you need anything, let me know, okay? Is there any questions for me? Oh, your MRI scan. I mean your CT scan. Okay, so that will happen at some point today. It depends on the list and queue within the CT scan department, okay? I will let you know as soon as they call me. Okay? Are you in pain right now? No? Okay, breakfast will be served shortly in the next 10 minutes, okay? Again, my name is John, and my dial number is 225 if you want me to come and help you. Just you've got the bedside phone there. And then, yeah, let me know if there's anything that I can help. All right? Thank you very much, ma'am, for your full participation. I'm gonna remove my gloves and do my final hand hygiene.